Okay, so here in this video we'll be discussing about the fascio-scapulo-humeral muscular dystrophy. So this dystrophy is actually the third most common type of muscular dystrophy. Okay, so we'll be discussing that how this occurs. This occurs whenever there is mutation of the DOX4 gene on chromosome 4. So this is actually a genetic condition where there is mutation on the chromosome 4. Now at what age this manifestation starts? So this typically starts from the age of 15 to 30 years. So there is weakness of the muscle, progressive degeneration of the muscles, which leads to atrophy, that is the loss of bulk of the muscles. So we can clearly see here the atrophy and degeneration of the muscles. One more thing to notice here is that the muscles of the face, scapula and upper arms, these are most likely affected. So here in this subject we can see that he is having muscular degeneration, especially over the scapula and over the arms. Apart from these muscles, there is also abdominal muscle weakness, which leads to lordosis. That means that there is an exaggerated curve in the lumbar region of the spine. So this lordosis we can see. Now I'll be discussing that what happens to the cardiac and the respiratory systems. So what happens in the cardiac system is that there is a dysfunction which is called as abnormal heart rhythm. So there is arrhythmia which is seen in the cardiac system, and in the respiratory system what happens that there is scoliosis and lordosis. This will result in restrictive lung functions. So this patient will be having restrictive lung functions. All this tidal volumes and this vital capacities, these all things will be reduced. Now coming to the facial muscles, there is facial weakness. This makes the patient hard to smile or in fact to use a straw. So remember that this degeneration, this sequentially causes weakness of the muscles of face, then scapula, humerus, potential lung, eye and hearing problems. So one more thing which I would like to discuss here is that there is shoulder weakness among these patients, and due to this weakness in the shoulders and the back, this is actually visible in these patients. So there is a weakness in the area of the scapula, the shoulder blades, and these are the first sign which we can see. So this resembles as a scapular winging. Okay, so there is winging of the scapula because of the protruding bone which resembles like a wing. So here we can clearly see the winging of the scapula in this patient. And coming to the lab investigation, the first investigation which we perform is the creatinine kinase level. So whenever the creatinine kinase level is increased, that is related to muscle atrophy. Now the second investigation is the electromyogram. So this actually measures the electrical activities in muscle fibers. The third one is the nerve conduction velocity. This measures that how fast the impulses are traveling from one part of the nerve to another. The fourth one is the muscle biopsy. This reveals the type of dystrophy. Now coming to the treatment part, actually there is no cure for this disease. Actually there is supportive treatment like physical therapy, pain control therapy and orthopedic interventions. So the main treatment is surgery to stabilize the scapula and to mobilize the upper arms. So this was all about fascio-scapulo-humeral dystrophy. Okay, thanks for watching guys.